Hi, I'm Dr. Shel. Today I'd like to talk about a subject that is very personal to really all of us, and that's sexual health in both men and women. We've done a lot of education on sexual health for women, but today I'd like to shine some light on a new procedure called the P-shot. The P-shot is a procedure in which we address men's concerns if they are having issues with erectile dysfunction or sexual dysfunction. So what we are able to do is, as a holistic practice, as a wellness practice, my approach is always a root cause approach. So when we see our patients, we always like to look at why they're having certain symptoms that they might be experiencing. So when you're looking at sexual health in men or erectile dysfunction in men, you have to look at a variety of things, including testosterone levels and hormonal balance overall. You also look at thyroid balance, stress levels, hypertension, any kind of vascular disease, as well as any other chronic illnesses that they might be taking medications for and what side effects they might be having from the medications. So we try to evaluate the entire picture, and once we've looked at that, and that of course would also include things like the gut function, nutritional analysis, etc. When we spend some time evaluating what's going on with the patient, we then determine if they're a good candidate for the P-shot. Now the P-shot is a procedure in which we use the patient's own blood, own platelet-rich plasma. So we would draw the blood and we would spin it down in a certain way where we can extract the platelet-rich plasma, and that basically has over 10 different collagen-derived growth factors that are then taken and injected into the area of the penis. And obviously we do topical numbing as well as local block so that it is as comfortable as it can be. And the PRP is injected into the penis so that you are then able to experience better erectile function as well as less sexual dysfunction, and are able to perform better and have better satisfaction. So with that, it's very important to follow the protocol and do things in a really good order, and knowing that it is your own cells and your own collagen-derived growth factors should really give you the ability to know that we're doing something that is more or less natural, because we're not using anything that is outside of your own body. We do also provide a pump that goes along with the injection and is able to then keep the area stimulated and keep the vascularity going and the blood flow so that your results are as good as they can possibly be. This is a procedure that men in general really appreciate, because obviously it can be a sort of embarrassing topic for a lot of men, but it doesn't have to be, because it is part of quality of life, and it is something that would definitely dramatically improve your quality of life. But one thing that I would definitely re-emphasize is everything has to be looked at from a root cause approach, and we shouldn't really just look at doing a procedure without looking at the underlying root cause, which is why our practice has always believed in making sure that we look at it as a holistic approach and offer our patients not just the P-shot, but testosterone pellets and other forms of replacement, and cleaning out the toxins from their body, as well as we like to combine it with a procedure called Emsella, which is a fantastic procedure, and you can see some of my other videos on it, but it talks about stimulating the pelvic floor musculature with electromagnetic stimulation, and these are some supramaximal contractions of the area in the pelvic floor. It has actually been FDA approved for urinary incontinence, as well as any form of stimulation in the pelvic floor muscles, and our male patients are very, very happy with this procedure, and especially very happy when we combine the two. So give us a call for any questions or any further clarifications on the procedure, and we're here to help you. Thank you.